Good morning, everybody. Today we are going to start on trial box. Now, what is trial box? Now, one of the important component of optometry examination is trial box. Let me tell you, this is Pablo Chandra. I welcome you for the unit 1 of our lecture in the subject of clinical optometry, which is trial box. Now, what is a trial box? As you can see, there is contents of lot of lenses. This trial box is very important for the optometrist. Why? Maybe you have seen in optical shops, maybe you have seen these things in many hospitals. You may be inquiring why this trial box is important. Maybe you are also thinking as a normal people also thinks why these things are important. And also, this is the reason why you have seen all these things. You have taken admission to optometry to learn all these things. So today I'm going to talk to you in detail about what trial box is, what are the components which are there in trial box, what are the lens which are there in trial box, what are the accessory lens which are there in trial box. All these things I will teach you and I will discuss with you in detail. Okay, so bear with me to understand what trial box is all about. Now, so the official definition of trial box is it is a box containing lenses arranged in pairs, a trial spectacle frame, other devices used in testing vision. It is also called as trial case. Now this is exactly what trial box or trial case looks like. I will tell you what are the components are there, what are the use, and you can see also there are a lot of the accessory lens, prisms, trial frame, all these things I will tell you. Now, before that, let's just look at the overview of the uses of trial box. In clinical refraction, from the name itself, you can understand we will learn how to do refraction in our eyes. Means how the light is passing through the eyes and how it is passing, how it is going through different refractive components and where it is finally ending. Whether it's in the retina, whether it's in the front of the retina, or whether it's in the back of the retina. And this evaluation can be done in various ways like objective ways, subjective ways. Diplopia charting is a different thing where we can understand whether the patient is having a double vision or not. We can also use these prisms as you have seen a lot of in the picture. We can use it for the diagnosis of the squint and assess binocular vision. All these things I will not teach you, but I will teach you what are the components of the trial box can be used for this test. Okay. So trial frame, it consists of trial frame, trial lenses, prism accessories, all these things it contains. So we will come across. The first of all thing which you have seen in the previous slide here is this one. You may be inquiring what is this? This is basically known as trial frame. It also looks like this. There are different types of trial frame. I will come to it one by one. Trial frame is an eyeglass frame designed to permit insertion of different types of lenses. These type of lenses are not permanent lenses. These are can be changed. Okay, so that's why it's known as trial lens. The lenses. Why it is known as trial lenses? Because it can be given for trial of the refractive power, not the permanent what you will wear in the spectacles. After getting the power from the trial lenses, we make a prescription, we send it to the optician. From the optician, the eyeglasses are made and it is given or dispensed to the patients, and then the patient wear it and then we can understand it. So the trial frame is basically used to check whether the patient vision is okay or not, and also to measure the refractive error. So what are the features of this trial frame? It is lightweight, adjustable. It should have a comfortable nose resting. It will sit exactly on the nose. It is very lightweight. It is adjustable. And we can also understand readily adjustable and allow accurate centering vertically and horizontal for each eye. So it can be easily adjustable, allow accurate center vertically and horizontally for each eye. And we can understand what are the uses of this trial frame. So these are the features of this trial frame. And these are basically used for us to understand the various activity. Now in the trial frame, I will tell you there are three to four component. The first component which you can see over here. Can you see over here? This component contains we can keep a high powered lens, whether it's a high plus lens or high minus lens we can keep. In the second component, we can keep the spherical lens. And in the third component, we can keep the cylindrical lens. Now, let me tell you, normally we have got two types of lenses. Okay, actually three types of lenses. One is a spherical lens, another is a cylindrical lens, and third is the accessory lens and the prism. Now, this spherical lenses is used to correct spherical powers. Cylindrical lenses is used to correct astigmatic power, and accessory lenses and prism is used to correct the prismatic power or the squint, which I have already told you. And last, we can use it for the first component, which is there. We can use it for high powered lens if it is required. Now, can you tell me why cylindrical lens is kept in the last quadrant, not in the first? Because cylindrical lenses, we can use the cylinder, we need to place the cylindrical in a proper axis. To put the cylindrical lenses, whether in the 30-degree, whether it's in the 40-degree, whether it's in the 50-degree, whether it's in the 60-degree. So it normally we prefer the last component for the cylindrical lenses. And last but not the least, after doing the refraction, if at all we require accessory lens like red filter or Maddox rod or prisms, we will use it in the extreme last component, which will be very useful. So these are the compartments of the trial frame. Cylindrical lenses compartments should be capable of smooth and accurate rotation. As I told you, cylindrical lenses, we need to use it for capable of smooth and accurate rotation, because accurate rotation and smooth rotation will help us to get the proper axis. Trial frame should be easy to adjust to both PD and corneal alignment. While now it's very important, not only we are putting the trial frame, we have to make the trial frame adjusted, whether it's tight or loose, whether the accuracy is alignment is okay or not. All these things we have to check. Until and unless we don't check all these things, we will not be able to understand where the lenses is. So the type of trial frame is a full aperture frame, reduced aperture frame, half eye trial frame. So full aperture, reduced aperture, and half eye trial frame will help us to understand where our trial frame is and what is the reduced aperture is and what is the half eye trial frame is. Full frame trial frame aperture is accommodates about up to 538 mm lens of each eye. I will come why what is the required of full frame aperture or full trial frame is required. So the diameter of the lens will be 38 mm. Independent screw adjustment is required for a PD of 48 to 80 mm. Screw operated bridge height and protection. Sides adjustable for length and angle. So all these things trial frame is required. So once we can adjust all this trial frame, then only we can put the full trial frame properly. Full trial frame reduced aperture. So once we can reduce the aperture, we can use reduced aperture in trial frame. Very durable lightweight drop cell trial frame. It holds up to 438 mm lenses for each eye. Accessories may be easily inserted and extracted. We can use the accessory lens for normal insertion and exertion. So this is a half eye, not you can use it proper normal trial frame, as you can see in this picture. Half eye trial frame, this is normally a half eye, okay, because a full frame, you have seen it in the picture, this is a full frame. All the four components are there, four to five apertures are there, one for spherical, one for cylindrical, one for the block, one for the accessory lens, and one for high power or the block. Okay, so 4 to 5 components are there. This is a half eye. You can see half eye lenses can be used. Half eye trial frame with a nose piece child as half eye trial frame PD of 54. PD means pupillary diameter. From one pupil to another pupil distance is normally known as pupillary diameter. Of 54 to 58, also available with fixed bridge and adjustable nose bridge. So the nose bridge is this one. You can use it, you can adjust it, and you can put it properly. So all this nose bridge adjustment can be done easily with the trial frame. So once you are using this trial frame, you have to put the nose bridge accordingly so that it can be used properly. Also available with fixed bridge or adjustable nose width, available for adults with 59 to 67 mm. For children 54 to 55, 58 for adult 59 to 67. You can see half, another half. Okay. So the trial lens. Now we are done with trial frame. Now we will come to come to trial lens. During refraction, the practitioner utilizes a set of known lens called as trial lens. We use a lens which power we already know. It's written over there. And these trial lenses are used for specific purposes of the patient. And we need to understand what is the specific purpose of the patient. So there are two types of trial lenses. One is the full aperture lenses, another is the reduced aperture lenses. Why we need full aperture and reduced aperture? I'm coming to it. So this is a full aperture. You can see there is no rim. Only the metal lining is there, approximately 38 mm, biconvex, biconcave form. They do not conform any of the additive lens principles preferred by many practitioners. Do not obscure patient face, heavier and thicker large additive error. Now, why this full aperture is required? This full aperture is required because whenever you have any visual field problem or the patient is having any you need full aperture lens to increase the visual field. So in those cases, you can use full aperture. Patient where you need the full vision, especially with low vision patient, glaucoma patient, all these patient, you can need full aperture lenses. Here is the full aperture lenses, concave and convex, both can be seen. Even accessory lens can also be made full aperture. Reduced aperture. You can see here there is a rim, that is why it is known as reduced aperture. This is a cylindrical lens, so you can see there is a axis given over here. So as you have seen in the full aperture, there is 38 mm. In the reduced aperture, it is 20 mm. Okay, the diameter is 20 mm. So the 20 mm mounted in the metal rim of 38 diameter, 38 mm diameter, plano-convex, concave, used for refraction and neutralization. It can be used for refraction of the patient for giving power to the eye. For refraction, curved surface should face the eye. For neutralization, curved surface of the trial lens is placed against to the curved surface of the spectacle lens. So for neutralization, with these trial lenses, we can not only do the refraction. What happens is for refraction, we learn so much of refraction, we forget that it can be also used for hand neutralization of the spectacle lens. That means what is hand neutralization? Those who don't know, let me tell you that if there is a spectacle power, suppose you want to check the power of the spectacle, you can use the spectacle and you can use the place the lenses in front of the spectacles and you can try to find out the power of the spectacle power. So whenever you try to find out the power of the spectacle power, the neutralization power what you will get is normally used for spectacle power neutralization. Okay, so this is the spherical lenses. You can see. So the pair of the spherical power is pair of the positive lenses ranging plus 0.12 to plus 20 diopter. Pair of negative lenses ranging 0.12 to minus 20 diopter. 0.12 diopter, 0.25 to 4 diopter into 0.25 steps, 4.5 to 8 diopter in zero point 0.5 steps, 9 to 14 diopter in 1 diopter steps, 16 to 20 diopter in 2 diopter steps. So we will check all the in these power steps. We have the power in the spherical lenses. Okay. Now, what is the uses of this spherical power? It is used to correct spherical ametropia. Let me tell you, ametropia means spherical refractive error for hand neutralization and also for checking the refractive error. So if a patient is having a refractive error, you have to check that. If the patient is having any cylindrical power, for that also you have to check that. Cylindrical lenses, as I told you, difference between spherical and cylindrical lenses. Cylindrical lenses are having axis and meridian. So we have, you can see here, the cylindrical lenses are having a marking. So this is the axis and the opposite side is the power meridian. As you can see here, this is the spherical lenses with the handle and no marking is there. So all over the lenses, the same power is there. But in cylindrical lenses, in one meridian, there is axis and in the other meridian, there is power meridian. So the power lies in one meridian. Axis meridian is marked on the rim of the lens. So in the axis meridian, there is no power. In the opposite meridian, there is power. So 19 pairs of cylindrical lenses are there. So what is the pair differences of the lenses? Plus 0.12 to plus 6 diopter, plus minus 0.12 to minus 6 diopter. 0.12 diopter is there. After 0.1 to 0.5, 25 to 0.4 in 0.25 steps, the lenses are there. And 4.5 to 6 diopter, 0.5 diopter steps are there. So it is used for checking astigmatism. As I told you, astigmatism is a refractive error which can be corrected by cylindrical power. So what is an astigmatism? Astigmatism in one meridian, there is no refractive error, or more refractive error in another meridian. There is a refractive error more or less to the other meridian. meridians. So in both the meridians, when you have different refractive error, to correct that refractive error, you need cylindrical lenses. Astigmatism can be corrected with the use of single cylindrical lenses, or astigmatism can be corrected with the use of spherical and cylindrical lenses for checking the refractive error, and also for hand utilization of spectacle lenses. So this is the main thing which we come across of the spherical and cylindrical lenses, which is very much required. Now we will come to the prism. I think you have all studied about prism in geometrical optics and physical optics, so nothing new in it. But most important, these prisms are present or available in our trial box. Okay, so this is the most important thing which you should understand, that this trial box not only contains spherical and cylindrical lenses, plus and minus lenses, but also contains prism. Now you can ask me, sir, why these prisms are there? These prisms are there for a lot of functions which we will come one by one. Prism is a refractive medium having two plane surface inclined at an angle. So one prism diopter produces displacement of an image at 1 centimeter when the object is situated at a distance of 1 meter. So you all know what is the work of the prism? Prism causes displacement. What is the work of the refraction of the lens? It causes refraction of the light. So basically prisms are used to for bending of the light. So whenever bending of light is required, we use prisms. So there is produced prismatic effect. Power range is 0. Half of 0.5, 1 to 6 diopter in one diopter steps, and in two diopter steps we can change the power of the prismatic eye. To correct and measure strabismus. Okay, so to correct and measure strabismus, we can use prisms. What is strabismus? It is squint. You can see a child showing squint. So whenever there is a squint, it can be used for measuring the squint. It can be also used for correcting the squint with exercise. Okay, yeah. Next point is the exercising prism. So prism has got a lot of main function of prism is with the correction of the squint. So to measure and to correct by exercises, by giving in the spectacle or by giving it in loose. So it can be used in very way in training for the patient, in correcting the squint, and also to improving the angle of the eye. Okay. For measurement and correction of angle of deviation, it is used in instruments like gonioscope, keratometer, slit lamp, and applanation tonometer. Now, prisms can be also be used for correction of angle of deviation. It can also be used in conioscopy, keratometry, and slit lamp and applanation tonometer. So all these instruments can be used with prisms. So plano lenses is there in red and green. Now we will come. Now I think you don't have any question with prisms. So I think most of the prism slides I have covered, although there are a lot of things are there. But for the trial beam, for the time beams, as you are starting with clinical refraction unit 1, you need to know these basics points about prisms. Okay. Now next we will go to the accessories. Okay. So in accessories, what are the things we are having? We have got a lot of things are there. Plano lenses, red green filter, Maddox rod, stenopic slit, occluder, pinhole, Jackson's cross cylinder, near vision chart. Now one by one we will come. Plano lenses, it's a zero power. It is used for satisfying and identifying the malingering patient. Now what is malingering patient? Malingering patient means patient who don't want to answer directly to your queries. There will be a lot of patients who will be not be using giving you proper satisfying reply. So whenever they will not using proper satisfaction reply, to understand that whether they are giving the correct answer or not, you can check it with plano lenses. You can put a zero power lenses and see the reaction of the patient. If then also the patient is giving the same reaction, then the patient is not cheating. But if the patient is giving a different reaction, that means you will understand this patient is malingering. This patient is not giving you a correct answer. Next accessories is occluder. Now, why this occluder is required? We all know in clinical refraction, whenever we are doing refraction, we do it uniocularly. Means we do it with one eye and we need to block the other eye. So whenever we need to block the other eye, we can use the occluder. So whenever we are using the occluder, we are closing one eye and we are doing the refraction for the other eye. So that we can do the uniocular refraction properly. And this occluder is very much required for closing one eye. So with that we can do the refraction properly. Okay. Pinhole. Now, pinhole is a very important thing. I think all of you have learned about the rectilinear propagation of light in your school, in your college, and everywhere. One of the biggest properties of light is rectilinear propagation of light, that light passes through straight path. Now, this principle is used in pinhole. So, whenever there are refraction, suppose you are taking a visual acuity of the patient. Let me give you. And the patient is not able to read all the letters on the chart. What you will know? There is some problem in the eye. Now you need to find out whether this problem is because of the refractive error or because of the patient's disease or any clinical condition is there. So if there is any opacity in the eye, so what will happen? Light will not go directly to the retina. It will get and stop. So whether the patient is cannot see because of the opacity or whether the patient is cannot be see because of the light is not refraction, what you can do is you can just put a pinhole in front of your eye. If you put a pinhole in front of the eye, the light will go straight through the hole and it will hit the retina and the fovea and you can see the object very clearly. Understood. So that's mean it will be clear that patient cannot see because of the refractive error. But if the patient cannot see because of the opacity, then the light will go and hit the opacity and come back. So the patient will not be able to see with the pinhole. So if the patient is able to see with the pinhole, that means the patient is having a refractive error. And if the patient is not being able to see, that means the patient is having a disease condition or an opacity in the eye. Now, opaque disc with a pinhole has got 1 to 2 mm in diameter in the center. It is an opaque disc which contains 1 to 2 mm of the opacity in the center. Allows only a pencil of light pass through the cornea. Only a pencil of light will pass through the cornea. It will helps to determine whether eye has refractive or pathological error. So pathological error or refractive error, which I was telling you, that will be easily evaluated with the help of this pinhole. The pinhole of 1.32 mm. So the hole is very important. You cannot use any hole. The hole size will be 1.32 mm is more effective. Usually available pinhole is 1 mm in ordinary trial box. In ordinary trial box, we get 1 mm pinhole. As I was giving you the principle, you can see in the picture, it cuts away the peripheral light and only the central light goes through the eyes and you can see only the central light is going and focusing over here. As a result, the patient can see it properly. Is that clear? So visual acuity loss, you can estimate whether it is through the because of the disease condition or because of the refractive condition. Next very important thing is the Maddox rod. Now Maddox rod is got a several series of high plus plano cylinder lens. Here you can see Maddox rod. This type of rod is there and not one rod, but there are many rod. And this rod contains high plano cylinder plus 11 diopter plano cylinder. Many are there. This is normally given to check the fovea. So if you want to check the fovea, whether the fovea is proper or not, you can put it in front of the eye and a straight line will look in the opposite direction, opposite way. Why? Because in one meridian it is plano and in the other meridian it is 11. And because of that, it can be used for looking at the straight light, okay, as a breakage of light. It is made up of several series of high plus and plano cylinder lenses. Patient sees streak of light through these lenses. Available in red and white color, uses as single and double Maddox rod depending upon the test. Basically, the indication of this test is to check the latent squint. Let me tell you one thing, that squint is not always necessary that it will be visible through the open eyes. It is also there so that we can see, we have to find out whether the squint is hidden or not. And to find out this hidden squint, we have to use Maddox rod. So whenever we put Maddox rod in front of the squint, if there is a hidden and we put a straight light, we can understand whether the straight light or not. If it is matching, then there is no hidden squint. And if it is not matching, then it will be a latent squint. And we will tell you in when we will do the binocular vision section that how to find out a latent squint and a manifest squint. This is how a Maddox rod looks like. It comes in like a stand and also can be loose. Another very important thing is a near vision chart. We all know distance chart is used for distance visual acuity. Near vision chart is very important. Why? Because this near vision chart actually help us to find out whether the patient is presbyopic or not. So whenever the near vision goes, patient may have presbyopia, patient may have accommodation problem, and it also checks the near point of accommodation. So near visual acuity is very much required, and it can be used by Snellen chart. And nowadays, a lot of near vision chart has come up, like Jagger's chart or other M chart, N notation chart. Any chart can be used, and it is easily available with your trial box, so that you can use it for correction of your accommodation or checking of your accommodation, and also to find out where the near point of accommodation is and what is the condition of the disease is. So this is how a near chart looks like. Okay, it is used from the working distance, one hand distance, or patient from where the patient sees. You can ask the patient to hold it in front of the patient's normal working distance and ask the patient to read. So when the patient starts reading it, you can understand where the problem is and what is the thing. Next is the stenopic slit. Stenopic slit, you can see there is a slit in the black hole. It is again used like a pinhole, but a slit of 1 mm to find out the cylindrical axis, and also to check a lot of uses on cylindrical, also to check the halos. Okay, and a lot of other things can also be done. So to allow the strip of light to pass through the corneas, you need to use this stenopic slit. So this is also another very important test which actually tells us about different types of halos, and also to check the cylindrical axis and the power correction. So this is also an important test for our. So what are the uses? As I was telling you, axis of the cylindrical, Emsler-Fincham test, which is used for halos to find out whether patient is having astigmatism, and also it can be used for vertex distance measure test. Now, what is this Emslie-Fincham test? In 360-degree rotation of the stenopic slit, continuous halo is seen in corneal edema. Breakup of halos is seen in immature cataract. So whenever continuous halo you can see, it is a corneal edema, or if the halo is breakup, then it's a immature cataract. Next point is the red and green filter. Red and green is either there is a red filter in the one eye, and you can put green filter in the other eye to dissociate the two eyes. So to find out whether the eye is suppressing or whether the eye is having a diplopia. So a lot of tests can be done like Watford dot test and Friend test, which we will learn in the next units of clinical refraction, and it's so with the use of these two filters. So red green filter is very much used to find out which type of test is done in which patient. It is used to measure the fusion and the squint. As you can see over here, red filter and green filter, which can be used to find out which problem the patient is having. Next is Jackson's cross cylinder. It is a combination of plus cylinder and minus cylinder. It is normally used to check the power and axis of the astigmatic correction. It's a complicated test which we will again do when we will do subjective refraction unit. For now, it is also an important component of the trial box. It is there in the trial box and you should know it very well. Now the uses, as I told you, for the subject verification of refraction, to find out exact axis of astigmatism, to check presbyopic ad, and also to check the amplitude of accommodation. So these are the, with this slide, I comes to an end of the unit 1 of trial box, and with that unit 1 is completed, and we can understand from now that our main components of the trial box and the uses of trial box and history taking is completed. Next lecture we will come how to record visual acuity. Okay, thank you so much.